Hi YouTube, welcome to the summary of our 7th week of 4th year medical school. And I'm going to put a disclaimer out here right now. I'm sorry, I just got out of the shower, I did my workout video tonight, and then I'm getting ready for bed. So I have no makeup on, my hair is still wet, and I'm in my scrubs because I'm at my new rotation and I'm currently on call. So that's the look going right now. But I wanted to finish this video and update you guys all on our last week of our last rotation that we were just on. So I think I left off, John was actually in the last video. That was really fun. Not sure he really enjoyed it, but it was good. We had a fun weekend, and then Monday and Tuesday our doctor was still gone, so we worked with another doctor, and also we spent that time kind of tying up loose ends, finishing some of our projects, and then also prepping for the COMLEX Level 2 PE, the physical exam part that we do out in Philadelphia. And that was going to be a week from that Monday. So we really had to buckle down and really practice. And so that was good. We did a few cases each day. We really practiced the real thing, timed it out. One of us was the patient, we'd be gowned up and everything, so you would practice asking to untie the gown and listening on skin and then tying them back up and draping them properly and everything. So that was really good. Working with the other doctor, we saw some patients too, and then Wednesday and Thursday were normal days, and Friday we had a half day because John actually was in a wedding back up at our home state, and so we had to drive, quite the drive that night to make it for the rehearsal and the groom's dinner and have him pick up his tux and everything. So Wednesday and Thursday were typical clinic days. Said I'd give you guys kind of examples of a day each week. So on one day I saw med check for lipids, I saw a dog bite, med check for hypertension, I saw 2 4-year-olds for their well child check, and a patient that had MS was having these symptoms. If we didn't really know if they were related to her MS or if she was having another relapse of it. So it was kind of interesting. We ended up referring her on, but yeah, that is what we did. I'll back up. On Monday morning, we actually saw 3 colonoscopies. The doctor we were with, she's a family doc, but she also does C-sections and colonoscopies and D&Cs and just a whole bunch of other procedures. And so that was really great seeing her do those. Anything totally interesting? I did a laceration repair, which I love doing. Yeah, so kind of a typical week. I hate kind of the last few days of rotation. I just hate saying goodbye and trying to finish up everything they wanted to do, and so that kind of stunk. But let's see, Thursday night we went over, no, what did we do? We had it on Wednesday night. It was super nice. Our physician and his family, his wife, cooked this amazing meal. It seriously was delicious, better than restaurant quality, a high 5-star restaurant quality food. I mean, it was amazing. And she invited us, John and I, over, and then another physician and his wife, and a retired physician and his wife and friend, and so we just kind of had a fun gathering at his house, kind of a get-together, and I don't know if it was for us or just a get-together of all those cool people, but it was awesome. Really good food, really good company, and it was just really fun kind of getting to know everybody. Then on Thursday night we went over to his house as well. It's a weird thing going on in my hair, and he went over our evaluations with us because it's so helpful, I think, when they do that, because otherwise it's just a piece of paper and they're filling it out and you really don't know exactly. So he'd give examples, and then he'd read to us our strengths and if we had any weaknesses, and that was really great. And also we finished up our projects. So I had one on peripheral neuropathy I gave a little talk on, just kind of random subjects. I'm having a hard time remember all the odd ones that I had to do. Oh, I did a big one on hypertension, and I learned a ton. I went on Up to Date in Medscape and the kind of new research behind treating hypertension, and I learned a ton, and I got to teach my physician a ton too, which is exciting. What else was, and then I also did the different lipid levels and when to treat depending on risk factors, when to use medical therapy depending on risk factors, and which reminds me, I have to send that to him. I made a little chart on my own and put on Word document, and so that was really helpful. Yeah, that was about our week. So we packed up our car Thursday night, Friday morning. I also started a new workout program. How did I forget that? Started a new workout program last week, and that was interesting. It's just 25 minutes a day, Monday, Tuesday, Wednesday, Thursday, and then you do double on Friday, so 50-minute, and then a stretch workout on Sunday. And so I struggled through that. I have not been working out at all during my rotations, which is just terrible. And it definitely has shown because I have gained, since the beginning of med school, I've gained 20 pounds. And since last year, I've gained about 12, like between 10 and 15 since the end of second year. And I know that's due to my eating habits and then also just not being active and not working out. So something needs to change, and sometimes I can't help it at rotations if I have free house. I mean, obviously I can make better choices, but sometimes that's hard for me to do, and if you're invited over or out to dinner with other doctors or other people, it's, I don't know. I could do better there. I know I'm making excuses, but I started this new workout program, and I'm really excited to do that. So anyways, I struggled through that all week. Let's see, so Friday morning was awful. We packed up our car, and I didn't do my workout because there's going to be no time that day to do it. Showered, got ready, got to the clinic, saw a few patients, said our, hasty goodbyes because we had to get on the road, which just stink. And then we hopped on the road and drove all the way up, and John picked up his tux, and we had an awesome time with this was a friend from college. John was a groomsman in his wedding, and it was just really fun. I miss being around all those people, and I just love it. I love going to weddings where it's just so happy, and they're such a great couple, and they're such great people. It's just, I don't know, it just gets me all excited. So we had a really fun time. We ended up staying in a hotel near where they were having their wedding, but it was complicated because we had to go back to John's house because we had all of our car packed full of everything that we're going to be living on for the next 3 months. So all of our clothes that we brought and all of our toiletries and all of our bedding and everything was our little car was stuffed to the gills with stuff. And we drove that up. We got there, found out we had a hotel room, which we didn't know we had. Stayed there that night. Then that morning, John had to be there early for pictures and getting ready, so I drove an hour across town and dropped off the stuff, did my darn workout, and then I had to get a shirt. I wanted a different blouse or a different top for my exam coming up, the one in Philadelphia, my clinical skills one, and so I wanted it higher, a high cut shirt. I mean, not that my other shirts are low cut, but I don't know, I didn't want to get docked points if somehow I was leaning over, and I don't know, so I made sure to get a nice high blouse that was nice at Target. Picked up that, we had to go through all of our stuff, drop it off. I don't know, it was just way complicated. Do a load of laundry because we needed some of our clothes washed for our trip to Philadelphia. Pack up our bags for Philadelphia because we're going to leave our car at the airport. It's just easier that way. Anyways, it was I was on a time crunch and rushing around. And it was chaos. Had to get back to the hotel because that's where I was going to shower and get ready because that's where my stuff was. Anyways, I don't know why I'm telling you all these details, but it was a very stressful day. Finally, was trying to get to the wedding, and I am such a country girl. I hate driving in the cities. And I had a little GPS, but a bridge was closed, or just a crossing of a freeway overpass, I guess they're called. And so my GPS kept rerouting me there, and I didn't know the area I was in. And oh my gosh, it took me 20 minutes to finally get back on a track that I was going to actually get to the church. So I was a minute late getting to the wedding. So I was kind of bummed I didn't miss really anything other than I just sit up in the balcony. But that was a bummer. But John stood up there with his buddy, and that was really, really fun to see. Really fun wedding. Unfortunately, we had to go home. We left at 10:30 because we were flying out to Philadelphia the next day and had our exam coming up. So we did that, and Sunday we got up and got ready, headed to the airport. We had a connecting flight in Atlanta, Georgia, which I have no idea. I'm like the one that like worries about details and plans and being prepared out of the two of us. And we had our flight out to Philadelphia, had a layover in Atlanta, Georgia, and then was bringing us to Philadelphia. And there was only a 35-minute, I mean, when we ordered it or when we got the ticket, it wasn't a 35-minute layover, but it had been changed so many times that actually on the flight day it was a 35-minute layover. And I was somehow not concerned about this. Like, I don't know if I have not had enough terrible flying experiences or what, but yeah, it worked out. We got to Atlanta on time. We booked it over to our other flight. We just brought carry-ons, which made it so much easier. And got on that plane and made it to Philadelphia. Except the only problem is when we made it to Philadelphia, we didn't really have a plan of how to get to Conshohocken, and that's where the town that our exam is in. It's like, I don't know, 35, 40, 45 minutes away. So, whoops, I guess. I mean, we knew the different transportation options, but we were just like, oh, we'll figure it out. So that took a little time, and it was just, kind of a travel stressful day, and we ended up getting like a van shuttle. They picked us up, and there's other people going to other places. Got dropped off at our hotel, checked in, and then we tried to relax. I mean, I was planning on studying and doing some cases on the plane and everything, but ended up playing Candy Crush and reading my book, like a fun book. And then we got to our hotel, got everything settled in. We hadn't had dinner, so I had my first official Philly cheesesteak. We went down to a little pub, and the first NFL game was on, so we watched that. And just relaxed. I mean, John kept saying, like, I'm just going to pretend like this is a mini vacation so that we won't think about the impending exam coming up. Because I think that's the worst. The anticipation is just awful. So we had a fun night and kind of just went to bed semi-early, I think 10 o'clock, so yeah. Anyways, that was our week. I'll let you guys know in my next video how the exam went and how my week is going now. So I'll see you guys later.